proposal to reduce Medicare drug payments is widely criticized. Washington. An Obama administration proposal to reduce Medicare payments for many prescription drugs has run into sharp bipartisan criticism, suggesting that it is easier to diagnose the problem of high prices than to solve it. Patients' advocates have joined doctors and drug companies in warning that the federal plan could jeopardize access to important medications. Every member of the Senate Finance Committee, 14 Republicans and 12 Democrats, and more than 300 House members have expressed concern. In a letter to Sylvia Matthews Burwell, the Secretary of Health and Human Services, the advocacy arm of the American Cancer Society said the proposal does not protect cancer patients' access to the life-saving drugs needed to treat their disease. The plan focuses more on the potential for cost savings than on how to preserve and enhance the quality of care, it said. The administration says Medicare's current payment formula rewards doctors for prescribing expensive drugs. Ms. Burwell has proposed a 5-year nationwide test to encourage doctors to prescribe less expensive therapies under Part B of Medicare. In its proposal, the administration said we intend to achieve savings, but did not estimate the amount. The first phase of the new payment model could begin as early August 1. In the second phase, which could start as soon as January 2017, Medicare would link payment to a drug's value. The government might, for example, pay more for drugs that it deemed more effective in treating or preventing a particular condition. Or it might pay the same amount for drugs that it judged to be therapeutically similar. These drugs, to treat various types of cancer, rheumatoid arthritis, macular degeneration and other conditions, are typically administered in doctors' offices or hospital clinics. They include drug products that are made from human or animal cells, as well as treatments that mobilize the body's immune system to fight cancer and other diseases. Continue reading the main story. Related coverage. U.S. to test ways to cut drug prices in Medicare. March 8, 2016. Congress and Obama administration seek ways to limit increase in Medicare premiums. October 5, 2015. Public Health. Obamacare flexes muscles with new Medicare payment plans. July 10, 2015. Data shows large rise in list prices at hospitals. June 1, 2015. Medicare typically pays 80% of the cost, and beneficiaries are responsible for the other 20%, meaning that they have to pay thousands of dollars a year for some drugs and drug combinations. Whatever the merits of the proposal, the administration has to date been outmaneuvered on Capitol Hill. Republican lawmakers say President Obama should withdraw the proposal, a step that appears unlikely at the moment. Many Democrats, alarmed at high drug prices, said the administration was making a worthy effort, but should not move ahead without doing more to protect beneficiaries. Representative Lois Capps, Democrat of California and a nurse, said she was concerned about several aspects of the plan. She listed the nationwide scope of the project, the possible impact on small medical practices in underserved areas, and the potential shifting of patients from provider offices to expensive hospital settings. 24 House Democrats, including Black and Hispanic lawmakers representing large numbers of poor people, said the proposal could disrupt care for their constituents. Doctors practicing in small groups and rural healthcare providers have less purchasing power, often must pay higher prices for drugs and will be unable to absorb the reimbursement cuts, the lawmakers said. Another 60 House Democrats, including some of the most liberal members of Congress, signed a separate letter listing even more questions and concerns. It is not surprising that drug makers like Amgen, Genentech and Merck have asked the administration to withdraw its proposal. But some of their concerns seem to resonate with patients desperate for new treatments and cures.